Many COVID-19 patients insist it's not real until they die, nurse says. You don't have to believe in COVID-19 for it to kill you. Judy Daring, an emergency room nurse in South Dakota, has watched that simple truth play out again and again over the last year, as many of her patients have denied the coronavirus existence or their own diagnosis up to their dying breath. Daring described her work as a horror movie that never ends on Saturday, in a Twitter thread that provoked hundreds of thousands of reactions. The nurse said she was particularly frustrated by the patients who embraced misinformation around the virus, even as it wrecked their bodies and eventually killed them. She added that there are plenty of patients who have done everything right and are so thankful, but it's the denier who really bother her. They tell you there must be another reason they are sick. They call your name and ask why you have to wear all that stuff because they don't have COVID, because it is not real. Darren later added that she doesn't believe the virus is making people turn mean, as one commenter suggested. I think the ones I'm seeing are just jerks. On Monday, she explained that she was simply venting during a rare night off and had not expected her tweets to go viral. The hardest thing to watch is that people are still looking for something else, and they want a magic answer. They are failing with anger and hatred. Their last dying words are, "This can't be happening. It's not real." South Dakota has the second highest infection rate in the United States, according to data compiled by the New York Times. It has averaged more than 1,423 new daily cases over the last week, and the state's death toll sits at 644 people. That's the second highest death rate in the country, as South Dakota has a population of only 884,000. South Dakota's neighbor, North Dakota, is the only state ahead of it on daily infection and death rates. Daring, who lives in the small town of Woonsocket, SD, compared the state's death toll to the town's population of 655 people. That's a very simple reason in our town gone, she said. The fact that we have this many deaths in a state this size is mind-blowing to me. More than 246,000 Americans have died of the virus since it spread to the U.S. earlier this year. Daring is one of the growing number of the healthcare workers who have turned to social media or news outlets to share their frustrations amid a surging second wave and a tide of misinformation about the virus. Goring says she doesn't care if her patients are Democrat or Republican, and she wants to scream, when people try to politicize the virus. She just wants people to wear masks and socially distance themselves to keep cases down. I'm not your first line of defense. I'm your last, she said, citing a memo from social media. It's frustrating. Questions about COVID-19. Here are some things you need to know. Symptoms can include fever, cough, and difficulty breathing. Very similar to a cold or flu, some people can develop a more severe illness. People most at risk of this include elder adults and people with severe chronic medical conditions like heart, lung, or kidney disease. If you develop symptoms, contact public health authority. To prevent the virus from spreading, experts recommend frequent hand washing and coughing into your sleeves. They also recommend minimizing contact with others, staying home as much as possible, and maintaining a distance of 2 meters from other people if you go out. In situations where you can't keep a safe distance from others, public health officials recommend the use of a non-medical face mask or covering to prevent spreading the respiratory droplets that can carry the virus. In some provinces and municipalities across the country, masks or face coverings are now mandatory in indoor public spaces.